Hello and welcome to this Vibrant publication summary video. Today, we'll be talking about the study called Relationship of High Sensitivity C-Reactive Protein with Cardiovascular, Diabetic, and Hepatic Biomarkers. Let's get started. Chronic diseases like cardiovascular disease, diabetes, and fatty liver disease remain among the leading causes of illness and death worldwide. A common thread linking these conditions is systemic inflammation. High-sensitivity C-reactive protein, commonly referred to as hs-CRP, is one of the most widely studied markers of inflammation. Elevated levels are linked to higher risk for heart disease and other chronic conditions. In today's video, we'll walk through a vibrant study that explored how hs-CRP relates to not just cardiovascular risk, but also diabetic and hepatic biomarkers, shedding light on its value as a central marker of lifestyle-associated disorders. This was a retrospective analysis of 438 individuals tested at Vibrant America's clinical laboratory. Importantly, these were free-living individuals without pre-existing clinical conditions. Researchers measured hs-CRP alongside a broad panel of biomarkers, including lipids, apolipoproteins, glucose-related markers, and liver enzymes, to see how inflammation correlated with metabolic health across systems. The results of the study were striking. The cardiovascular panel showed that hs-CRP correlated positively with triglycerides. Meanwhile, it correlated negatively with protective markers like HDL cholesterol and Apo A-1. In other words, when hs-CRP was high, triglycerides were often high too. Meanwhile, protective markers like HDL and Apo A-1 were often low. The diabetes panel revealed that hs-CRP showed positive correlations with glucose and glycated serum protein. In other words, when hs-CRP was high, glucose and glycated serum protein were often high too. Similar to hemoglobin A1c, glycated serum proteins reflect how much sugar has been attached to proteins in the blood. However, because serum proteins have a shorter lifespan than red blood cells, they provide insight into average blood sugar levels over the past 2 to 3 weeks rather than several months. The study also found that elevated hs-CRP was significantly associated with higher insulin levels. In other words, when hs-CRP was high, insulin was often high too. The hepatic panel indicated that hs-CRP correlated strongly with AST, a liver enzyme involved in amino acid metabolism. And it was also correlated with alkaline phosphatase and bilirubin levels. In summary, higher inflammation, as measured by hs-CRP, was linked to worse profiles across cardiovascular, metabolic, and liver health. So what does this mean clinically? Well, traditionally, hs-CRP has been used as a cardiovascular risk marker. This study reinforces that role goes further, showing that hs-CRP also reflects metabolic and liver dysfunction. This expands hs-CRP's value as a biomarker for early detection, risk stratification, and preventative care across multiple disease domains. At Vibrant, we integrate hs-CRP testing within broader cardiometabolic panels, like the CardioZoomer. The CardioZoomer provides a comprehensive assessment of cardiovascular health across key risk categories. Specifically, our CardioZoomer measures hs-CRP alongside advanced lipids, oxidative stress, metabolic status, endothelial balance, and clotting markers to reveal both traditional and hidden drivers of disease that standard cholesterol tests can miss. This comprehensive approach reflects the findings of the study, giving providers a more complete picture of how systemic inflammation impacts patient health and where targeted interventions may help. The CardioZoomer can be bundled synergistically with the cardiogenetics to provide even deeper personalized insight. Our cardiogenetics test evaluates key genetic variants, or SNPs, involved in cholesterol metabolism, blood pressure regulation, inflammation, blood clotting, and drug response, providing actionable, precision medicine insights for personalized prevention, early intervention, and lifelong heart health. To summarize, hs-CRP correlates with triglycerides, glucose levels, and liver enzymes. Meanwhile, it inversely relates to protective markers like HDL and Apo A-1. In other words, it serves as a central marker of cardiometabolic and hepatic risk. This makes hs-CRP a practical, powerful tool for identifying at-risk patients earlier and guiding more holistic interventions. If you'd like to read the full publication, check out the link in the video description to access the study. If you're a provider looking to integrate hsCRP and other advanced biomarkers into patient care, explore Vibrant's cardiometabolic testing panels like the CardioZoomer and CardioGenetics tests. And if you're a patient, let your provider know you're interested in Vibrant's CardioZoomer or CardioGenetics tests. Together, we can bring precision and prevention to the forefront of healthcare. To learn more, visit the links in the video description. If you have any questions, please ask them in the comments below this video. Thanks for watching, and I hope you have a vibrant day.